Hello and welcome to the Functionally Enlightened podcast with Dr. Sharon Surita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Hello, everyone. Welcome back to the Functionally Enlightened podcast. I'm absolutely thrilled today to introduce our next special guest, who is a true inspiration and a fellow warrior in the journey of healing. So help me in welcoming Jennifer DeGlopper, who not only is a remarkable individual, but she's a fellow mesh implant illness survivor. And I'm so honored to have her here on the show. She's going to be sharing with us her strengths and her insights, and just super excited to have this conversation. Thank you for joining us today, Jennifer.
Hi, Sharon. Thank you for having me. It's an honor to be here. I just wanted to say how proud I am of you. I remember back in 2019 when we were both going through tough times, and the fact that you have turned this into a platform to help so many people, I just couldn't be more inspired by you and proud of you. So thank you for having me.
I appreciate that. And you were actually one of the biggest inspirations for me, because I think you were a couple of steps ahead of me in the healing journey and just in gaining the knowledge that we as implant illness, we'll say warriors, you had the wisdom there. You've already been treading that path. So can you share with our audience what was the beginning of your journey like? What led you to this implant illness communities?
Sure. So, in 2018, I was diagnosed with precancerous, like a pretty high level precancerous cervical cancer that they were designating as like a low level cancer. So I needed to have a hysterectomy. So that led me to a major hospital in that's about 2 hours from my house, where I coordinated all my care. I had a gynecologist who was an oncologist, and I also had a hematologist because I do have a bleeding disorder where I bleed more than normal when I have procedures. And so I was preparing for this gynecological surgery, a modified radical hysterectomy, and the surgeon let me know that I needed to have my hernia repaired at the same time, because it was going to require opening up my abdomen for the hysterectomy. So, the vibe I got was no big deal. We'll have a general surgeon involved. I don't even think they had an appointment for me to see the general surgeon. He was just going to do a hernia surgery while they were doing this hysterectomy. And my primary care doctor, who was really excellent, said, you want to go see this person who's going to treat your hernia. Like, you're not a piece of meat. Like, go see him so he at least knows who you are and he knows your background. So I set up an appointment with the hernia surgeon, and who is a general surgeon. And don't piece of cake, don't worry, we do this all the time. So in January, I had the multiple surgeries, and it was, how do I say this? The hysterectomy was like a piece of cake, but the hernia surgery was not. They said, and I had warned the surgeon of this, that I knew that I had more than one hernia. It had been suggested that I needed a abdominal reconstruction. I told him that before the surgery, and he said there were so many hernias, it was like my abdominal wall was like Swiss cheese.
Wow.
So I also had discussed with him prior to the surgery, I wanted to know what mesh he was going to use, right? Because you read, so, I see all the commercials about hernia mesh and lawsuits, and I wanted to know, like, what mesh was he going to use? And he said the best mesh available, which was a biological mesh that would absorb. And so I said, I'm allergic to cats and dogs and feathers and like a million other things. How do you know I'm not going to be allergic to this mesh? And, the answer was, don't worry. It's the way it's processed. Like nobody's allergic to it. So, I felt like I had crossed all my T's and dotted all my I's. And I went forth with the surgery with the plans in place and everything set. But immediately after, I had complications. I ended up having pulmonary embolisms because they gave me too much of the clotting factor to help my blood clot. So I swung the other way. I I was discharged from the hospital January 16th. On the 23rd, I was back in the hospital because I had 101.5 fever. I had a high white blood cell count. And they did a CT scan, which showed I had a hernia back
already
after all of this.
Yeah.
So I was admitted to the hospital for about a week on IV antibiotics. They placed drains inside to, I don't know, to like help things drain, I guess. And I ended up being admitted again in February, same thing. They called it like sepsis or the beginning of sepsis. I had a third drain put in. Then in March, I had 101 fever. I went back to the hospital. So this is my third admission into the hospital by March. And they did a CT scan and found that the mesh had formed a ball in my abdomen. My body was rejecting it. It was probably infected. So at that point, I had another surgery to remove this ball of mesh, and a wound vac was placed to help that heal. And that I ended up having the wound vac for 2 months to help the wound close. And then at some point, the wound tested positive for MRSA. Wow. So in May, the wound vac was removed, but in July, I ended up back in the hospital with the fever. My lactic acid was high. My white blood cell count was high. And I had a seroma from the mesh because they didn't remove all the mesh. They just removed the ball of mesh. So there was still mesh that was in there floating around.
Did they use just one mesh, or was it multiple mesh to repair each hernia?
No, it was like one big sheet of mesh, which I think is sort of like a shortcut, right? What was weird is that the hernia surgeon came out and told my mom and my boyfriend that it was going to take 5 to 6 hours to fix all of these hernias. On top of what they already thought the surgery would take, but they finished much quicker than that. So it was more because I don't think they had a lot of time scheduled for the hernia repair. They just didn't. So I know that they just slapped a big piece of mesh in there and that was it. So part of it was in a ball and then part of it was still there. So at that point in July, I involved an infectious disease doctor, and he repeated a CT scan and an ultrasound and determined that there were multiple seromas around the mesh. And he said, the only way you're going to get over this is to have the rest of this mesh removed. You can't leave it in you. It's infected. You're obviously having terrible reactions to it. He said, but he gave me some very good advice. He said, the surgeon that put the mesh in is not going to want to take it out. He said, you have to find somebody else. So, and I know that like one of the best hernia surgeons in the country is located in Sarasota. And I had been seen by him years ago because I knew I needed hernia surgery that I had been putting off. So I already was an established patient of his.
Okay.
He didn't do the surgery because he didn't practice at the hospital where had to have all of this done. Otherwise, I mean, that was, looking back, that was probably the biggest mistake, was not to get him involved much sooner. So I saw him, and he said, you know, he agreed. He said, the mesh, we got to take the rest of the mesh out. Like, so, and I saw him in September. He said, you know, you can go see a friend of mine who's in, I think he was in North Carolina, and see what he thinks. So I did. I went to North Carolina. I saw his, you know, didn't tell him anything about the background or what Dr. Eunice had recommended. And he agreed that the mesh had to come out. So in December of that year, I had another surgery to take the rest of the mesh out. So now I have hernias. Like, I know they're there, but my life was much easier living with the hernias than it was this year of just horrible events where I reacted so horribly to the mesh.
Yes, and I lived a similar experience where, you know, I've had absorbable mesh too. I'm open about the type. It was Phase-6 ST that they used in my entire abdominal wall for 2 hernias. But I did have the component separation. So they placed the mesh in between the layers. That way, when they had to go back in to remove it, they had to do an opposite incision, like from sternum to pubic bone, and basically peel back those muscle layers to dissect the mesh that was getting embedded and like inflamed on one side. So it was really a mess, and it caused nerve damage, just the actual inflammation part of the implant. So once I had the explant, that bulge in the abdominal wall became way more apparent because there's nothing holding it together. So I live with a binder. I wear a binder 24/7 for that purpose. But as you said, my life is much improved compared to the prior when the implant was still there. So there's a couple of things you mentioned. So yours was an absorbable mesh. I know now there are certain surgeons, and of course, with our research, we've spoken to many hernia specialists. You and I probably haven't trying to figure out how to get back out of this situation. But in speaking with them, I now see that they're testing more, or they're concerned more with people who have inflammatory conditions pre-existing, like autoimmunity, or just like you mentioned, you had several sensitivities or allergies, and that was never brought up during your consultations, right?
Well, no, I brought it up. I brought it up. And, you
Yes.
know, I have Hashimoto's thyroiditis, and I have had a positive ANA showing that I do have autoimmune type issues. That was brought up, but he was not concerned.
Right.
Like,
Right.
don't worry. My mesh was A cell, and it was bovine mesh. Yeah.
It's a different style, but it's good to know because there's that consensus too that the biologic mesh is safer and it doesn't cause those inflammatory reactions as it did in you. In your case, you had the inflammation there that was perpetual because of the infection. And so they gave you the antibiotics via IV for how long was it in the beginning?
There was a lot of antibiotics.
Yeah.
There was probably, and then I had antibiotics after the mesh was removed. So all in all, I would say I had IV antibiotics at least 6 times during 2019, and at a minimum of a week to 2 weeks at a time.
Wow. Yeah.
It was, yeah.
How was and I asked this because I had a horrible reaction to 3 different forms of antibiotics myself.
Yes.
How did you tolerate all of that?
Yes, there are very few antibiotics right now that I can take. I can't even tell you what they are because my list of antibiotics that I can't take is so long. Yeah. At the end, I had a pretty severe reaction to vancomycin that actually landed me back in the hospital. And that's one that you're not supposed to react to, or at least they say they don't see as severe reactions. They talk about like red man syndrome, but this was beyond that. I had hives that were just unbelievable, and like my face was swelling up. It was bad. So yeah, no, that definitely played into all of this because going in, there were a number of antibiotics I couldn't take. And by the time that year was over, like that list grew longer. There's now more that I can't take.
Yeah. Yeah. And in your case, you couldn't opt out of it. And sometimes, they prescribe the antibiotics more as a preventative during the surgery, but you actually had full-blown infections that were systemic at that point. And also, what we're learning now with the mesh, along with any other type of implant, that we're getting these biofilms developing over them that kind of keep the bacteria in a safe colony. So even though you have antibiotics coming in to kill off everything else, right? It kills off the good and the bad. Once the course of antibiotics is done, then that biofilm kind of lets up and the bacterial infection just goes all over the place again. And that's why I'm seeing more and more people having to do recurrent antibiotics, but they're never addressing the biofilm. And with an implant, if it's recurrent infection, as in your case, there is nothing else to do but remove it. And in some cases, some people have another implant put in place, but it's not often recommended when you have the autoimmune conditions. Right.
Right. Well, a couple of things. I wonder because the first surgeon that put the mesh in, he did mention when he put the wound back in that he thought I had a biofilm. And I'm wondering how IV antibiotics could possibly even get to that, right? I mean, how would it reach the mesh or like the tissue that is surrounded the mesh? Do you know the answer to that?
So,
Or just does it not reach it?
I believe, based on the studies, that it does reach the surrounding areas. But again, that tightly formed colony is going to prevent proper interaction between the agent that they're using and the colony or what's within that colony. So that's where, even with recurrent UTIs, when we're seeing that with pelvic mesh, that's the main issue there as well, that it's recurrent because that even if it's a 1 month or 2 months of antibiotics, while you're on antibiotics, they notice the symptoms are kind of resolving. But after a month, when that course of antibiotics is over, symptoms begin to return. And if they have it cultured, they see it's a similar strain, but also those colonies are converting or they're adapting to their environment. So they can, in essence, become a new strain.
Oh, that's interesting.
Yeah.
And that kind of does mirror my experience because I would be admitted to the hospital, I'd be on the antibiotics, and the fever would go down, and my white blood cell count would return to normal. Then I'd be discharged, and then I would end up back again a few weeks later. You had a second question that I don't think I addressed. Do you remember what that was?
Let me think about it. Talking about, well, I guess it goes back to where you're experiencing these kind of mast cell flares, where you mentioned the hives and things like that are coming up because of not just whatever is systemic already, but the pharmaceuticals that you're receiving. So I guess that can pivot us away from where you have received the explant and how you started to feel and how you overcame some of the systemic issues that you had been dealing with over those, how many years again was it?
It was pretty much the whole year of 2019, like literally, because the mesh was removed around Christmas and the initial surgery was January 9th. So I pretty much lost the whole entire year to this mess. And the healing part, it took a long time. You and I had similar scars, if I remember. To take the mesh out, they had to open me again along the same line that was opened for the hysterectomy and the initial repair. So I don't have a belly button. I have a scar that's like
we're twins there.
We are. And that was a pretty painful process. I used a walker for a little bit. It was hard, definitely hard to get around after the mesh was taken out, but I did, like, it fixed it. It fixed the problem. Like, I did the sepsis issues stopped. The I had a low grade fever, I think, for a little bit, but that was probably because I was healing. Um, and I don't, I, not to be dramatic, but I think it saved my life. Like,
Mm-hmm.
I don't think I could have gone on had this mesh not been removed.
Mm-hmm.
And it's not, there's the physical toll, but there's a mental toll
Yes.
as
Yes.
well that is just insanely huge, because you lose, like you, I was a very independent, mostly healthy person, and it just takes you down. It really does. You're
Mm-hmm.
reliant on other people, and I remember just saying to the initial surgeon, I just want my life back. Like,
Mm-hmm.
I'm so over this. I just want my life back.
Right.
And it's, life after is different. My abdominal wall will never be the same as it was. It's forever damaged. But, and like I said, I have hernias now, but I'm not. It's much easier to live with the hernias than it was to live with the mesh. And
Yes.
till something better comes along, I'm just taking it as it
Right.
comes.
Right. And I love that message, Jennifer, that you just put out there to give hope to those people, because they're told oftentimes that if you have an explant, even if it's possible, because some people are still claiming it's impossible, that you'll be worse off, that you'll be completely immobile or disabled. And in our cases, I'm going to speak for myself, and maybe you can, that resonates with you, but I was bedbound. I was bedbound
Mm-hmm.
for many months, up until the explant. And then, of course, the recovery process took a long time. For me, I imagine that the toxic burden was so high that it actually took me 2 or 3 years to regain some functionality where I could feel, I did some work from home virtually,
Mm-hmm.
but I wasn't able to go back to doing any home chores or helping with the family, helping the children, taking them to school. None of that for many years. And it's just, there is hope. So I love that you brought
Right,
that up.
right. And you were even wheelchair bound for a bit, were you
Yes.
not? Like,
Yes, I do have a wheelchair. And, just again, in full transparency, we might overdo ourselves sometimes, right? Yeah, we might
mm-hmm.
take on too much physical activity, or maybe the stress, because we're all susceptible to the impacts of stress. So if I overdo it, I do need to fall back onto some of my aids. Like, I use a rollator for longer walking distances if I need to. And then in the case where I know I'm going to be out of the house all day, I do have the wheelchair there just in case, because I know I have boundaries and I don't want to go and exceed those boundaries to make myself bedbound again.
Right, right. That's a very good point.
Yeah, and I know during your healing journey, I reached out to you many times, and this was before I pivoted to functional medicine. You're the one who kind of guided me to find these more local surgeons. I flew to Cleveland, Ohio, and consulted with Dr. Kurpata there. I consulted with a couple of like plastic surgeons that were well versed in component separation or in abdominal reconstruction. But ultimately, I did wind up seeing the surgeon that you recommended.
Mm-hmm.
But that being said, so I know when I was speaking to you, one of the things that kept me going was seeing that you were able to do some of the activities from before. I believe you said you were biking and able to
Mm-hmm.
do some exercise, and that to me was so encouraging.
Right, right. Yep, absolutely. It's for me, I would say the full healing process probably took a full, yeah, year, but I was able to be active about 6 months after the mesh was taken out, and it was gradual. Like, with any health crisis, it's depressing. Like, you feel like you're not making progress, but then I would look back and I would say, okay, well, last month I couldn't walk to the end of the block. I couldn't do this, and now I am. So the process was gradual, but it was definitely there.
Yeah.
And today physically, I'm very careful because of my abdominal wall. Like, I don't do sit-ups or
Mm.
crunches or anything that's going to stress that
Right.
area, because I don't want bigger hernias or more hernias. But beyond that limitation, I really don't have any. I've
That's
regained
amazing.
full functionality. Yeah.
Yeah, that is so inspiring there. I'm glad to hear it. That and knowing also that you did not get another mesh implanted. So you are able to fully function. I love that you're able to, I know that it takes time, but you were able to detoxify because once that mesh is in you, it's reactive. They tell you that it's inert, but it's reactive with all of the chemicals in your body, right? So we have our blood circulating through it, and it's carrying with it all the hormones and all of the neurotrans, everything is going through it. And so that impacts the way we feel mentally, emotionally, physically, all of that. Just thinking about the inflammation and the toxicity in our bodies. So some people who are unable to have explant, there's still so much that they can do otherwise in terms of their diet and their lifestyle to bring down the toxic burden of the body. So like you could start with things like air quality, water quality, making sure you're drinking filtered water since that's something you're doing on a daily basis. And not just like the Brita filters or refrigerator filters, but like reverse osmosis, like something that's really going to cut most of those contaminants out. But in the case of your recovery, are there any tips that you can provide for our listeners that, stuff that is attainable for them in terms of goals?
Yeah, I think just to get outside and like try to be as active as you can be without overdoing it, and I think we all have a tendency to kind of isolate when we're going through something like this. I know I do. Like, I didn't want to see friends. I didn't want to carry this wound back to dinner. Like, I just socially, I just isolated probably more than I should have. And I would say that family and friends are important, and that support system is important. And being careful with your diet. I think I was always careful going in. I went into it a vegan. I'm not as strict now. I mean, I do eat seafood, but I've had a pretty clean diet throughout. But I spent this morning listening to a couple of your episodes, and there's such good information in there. I'm going to go back and re-listen to a few.
Appreciate that.
But
Yeah, and the
what
information you're sharing is going to really be impactful to our audience because, like you and I, they're experiencing not only the disabling condition, they're going through the pain, the chronic pain, and they're really being shunned or gaslit by their medical providers and thinking that there's nothing that can be done. But you're the testament right here. Like you've done it, you've gone through it, and you've advocated for yourself to get to where you are today.
Yeah, thank you. I think the best advice was the local infectious disease doctor who told me the doctor that put it in is not going to take it out. He said, because, they're not paid, they're paid on a set rate for hernia surgery. And it's, it is what it is. And to take mesh out is a much more complicated surgery than it is to put it in. So I guess that's my other message is if you're not getting the answers from your current provider, there are others.
Yeah.
You just have to seek them out and get a second, a third opinion. I kept trying to work with the surgeon that put the mesh in because I felt like he knew what he was doing and he was the expert and he had me opened up twice. Like I figured that he was giving me the best advice, but I just got to the end of the rope and figured out that he wasn't. I needed a different set of eyes on everything and somebody else to take a fresh look.
Yeah. And not everyone actually develops the issues immediately. I think you and I, there's probably a handful of others who, within that post-operative period of 3 months, they knew that something was wrong and they were not healing. The inflammation was there again. The infections were spreading or persistent persistent infections. But with people who are a year out, 2 years out, and even 5 years out, I've seen people 10 and 15 years out, that they are able to seek out the help in terms of the chronic pain piece. Like there are surgeons well versed in the removal, and just exactly what you just mentioned. You have to seek them out. And there are various Facebook support groups that provide these lists, and you can revisit them, but always do your research. Like really consult with multiple surgeons when you're approaching it, because maybe I'll speak again for myself. I didn't do the research as much as I know I should have. Prior to this, I was an environmental engineer, and I knew all about toxicants in the human body. So I trusted my surgeon with the supposedly biologic mesh. They implanted a biosynthetic, so it did have some polyester in it. And I don't know if it was the polyester itself that I reacted to or just the mesh in general. I know that I reacted to it, and it took 4 months for me to find a surgeon to validate that, because everything looked good on paper. Like for me, it wasn't a visible thing. And for you, you had some of the markers showing the white blood cell count, and then you had the cultures done. So was there anything else that kind of triggered the alarm that, yes, this is the problem? Or was it more the infectious disease doctor that really transitioned the care team there?
I think it was just the fact that I kept having to go back to the hospital, and I didn't live close to the hospital.
Mm.
It's like 2 hours away, and every time I would go back, they would admit me, and there were multiple. My neutrophils were high, my lactic acid was high. I mean, there was multiple markers that were off, just throughout each time, and it was. Yeah, I knew something really wasn't right. And it was once he removed the ball of mesh and I went through the wound vac, I thought, well, this is it. Right now I'm cured because the ball of mesh is gone, and and then it came right back again. And that was just depressing, for lack of another word.
I agree
Very
with that.
depressing.
Similar situation in that where I did have multiple ER visits and probably had about 8 to 10 CAT scans within the period of a year, which is a lot of radiation,
Yeah,
right? We're not
yeah,
supposed to have that
absolutely.
much radiation. But when we're thinking about, again, those markers of inflammation, they were there for you. They were evident. Were there any other, let me rephrase it. Were there other symptoms that you experienced that really were abnormal, such as tachycardia or nausea and vomiting, anything like that?
Um, there were pockets of fluid that kept forming around where the mesh was that they could see visibly on the x-rays. I felt miserable. I mean, it's hard to pinpoint. I mean, I had it all. Like I had high fevers. I was just miserable. I felt sick.
Yeah.
Like I had the flu.
Yes.
It, so I mean, I don't remember like tachycardia or nausea being one of my primary symptoms, but I know I had nausea. Like I remember taking Zofran and having something prescribed with the antibiotics, but it was hard when your body is just being bombarded by all of these antibiotics
Yeah.
too. I mean, that alone will make a person
Mm-hmm.
feel crummy, much less all of the inflammation and everything that's going on in your body.
Yeah. And you mentioned it took about a year to really feel as if you recovered, and this is a year post-explant.
I would say so.
Mm.
Yeah. Yeah. What were your thoughts on that? How long do you think it took you?
Oh,
Or
for
do
me, it
you
took a
feel
while.
recovered? Yeah, yeah, I remember.
Yeah, so systemically, I would say functionally, I'm 80 to 85% better, and that's again attributed to the fact that there's nerve damage in my abdomen, so that muscle has atrophied. I can't do anything about that at this time. Maybe in the future they will be able to do nerve grafting, but that's that's not possible at this time for the abdominal wall, right? But in terms of the dysautonomia that I developed during that whole scenario, it really did take the 3 years for me, because I was going through the conventional route. I was taking all of the dysautonomia drugs that they call them, or the mast cell stabilizers. So it's like the Pepcid, Claritin. I was taking Cromolyn. I take, what were some other ones? Of course, some antidepressants were prescribed in the mix. Anti-nausea medications, Zofran, PPI, so many different things. And none of them even really touched the symptoms. I didn't feel any relief. And so I kind of started to shift from that to functional medicine. And I wound up dropping each one of these. I don't take any of those pharmaceuticals before, and then really just working with natural supplements, the diet, and the lifestyle. Like lifestyle is such a central piece that we overlook, because the stress that we are going through on a day-to-day basis, like we don't unplug. It's not like we're out there, you know, a lion and a gazelle, and you have that stress episode, and then you're done. Like either gazelle is gone and the lion is satiated, so there's no more stress. But we are constantly exposed to the stressors. So that being said, it's a lifetime thing that we have to do. And so before we leave off, I wanted to ask you that question, like, what are the lifestyle things that you make sure to keep in place so that you feel pretty functional?
Yeah, so oddly, I'm starting to have some of these things that you're mentioning. Like I'm having the more mast cell issues and low blood pressure and things that are just kind of like creeping back in, which I don't know that I can attribute that to the mesh. That could easily be something else. But I would say like staying well hydrated is something that I notice absolutely helps me. And you know, as women, I think a lot of times with medical providers, we're just gaslit. It's like beyond frustrating. I now advocate for women in the bleeding disorders community, because that's an area where women traditionally have been gaslit. You know, your periods are heavy. Oh, all women have heavy periods. You become iron deficient and anemic, and you're told, oh, that just happens to women. For many, many years, women were told that they couldn't have hemophilia, that it was just a man's disease. And we're learning now that that's not true. Women that carry the gene, they actually do, a lot of them experience symptoms of having mild hemophilia. So through that community, I've learned to advocate, and like how to advocate for yourself. It's really an art, especially when you're dealing with traditional doctors that tend to discount the symptoms that women have. So, you know, I think it helps to document as much as you can, you know, logs and portals. I think portals are excellent. When you send a message through a portal, there's documentation of that. And I think it's also about finding the right providers to be on your team, because so many just don't listen. The medical system is just broken. You know, they have 20 minutes, and it's just sometimes not even that, and it's just not long enough.
You see the doctor for 5 minutes, and then you have either the nurse practitioner or an assistant that is handling all of the intake session part. So that is 100% one of the most crucial tips, is that you need to find your medical care team that is going to be supportive rather than feeling like you're being dismissed.
Absolutely.
I agree with
Absolutely. That. So your switch to functional medicine, is that what you think got you through?
Yeah, I do believe I started with a nutritionist, an ancestral nutritionist, to work out the kinks as to like what were my reactive foods. And then from there, I started doing the functional lab testing, and I really kind of uncovered all of those imbalances in my body. And just, you know, again, I retest every 3 or 6 months to make sure I'm on the right track and not over supplementing or under supplementing, making the changes as I need to, because we're evolving, right? Every day we're exposed to different things. And just, again, our stress levels change from day to day. So we need to be supportive of our bodies. And those symptoms are really not something to be fearful of, even though I think back and I remember how horrible some of those symptoms can be. but they're just an indicator letting you know that, hey, your body needs something. So let's try to figure out what it is and support it. Going through craniosacral therapy, I'm also learning that we need to give ourselves love and grace, and just understanding that all things will pass and we can just kind of breathe through it. And yeah, it's hard when you're in the midst of it. It really is, but that's all we can do at that time. Like, breathe through it. If you're immobile, breathe through it. Meditate. Find something that you can be grateful for. Whether it's like visibility, if you're able to see colors. I remember in the darkest times, I would be laying in the bed looking out the window, and I could see the wind rustling the leaves, and that's where I would focus for however long I could focus. Whether it was 1 minute or 5 minutes. That's kind of where my anchor was.
Wow. Well, you're just an inspiration. I mean, I lived through those times with you, and I know how bad it got. And the fact that you are doing so much better. I mean, even 85% better speaks volumes, because I know how difficult it was back then.
I know we could go into a whole nother episode if we talk about the mental hardships, but we'll save that for another time. Jennifer, is there anything that you would leave our audience off with that would be something, again, that you cannot do without on a day-to-day?
Connections, family and friends, and gratitude. Gratitude. I'm just happy to be here.
Love it. Yes, thank you so much. And if you would be so kind to share any information about the advocacy group you mentioned, maybe we can put it in our show notes. But are you able to share the name of that group?
Sure, I'll send you something.
Okay, all right.
Yeah.
So we truly appreciate your time, Jennifer. I know it takes a lot out of us to kind of relive some of those moments. So I hope that after this, you can unplug and reconnect with your higher self and the person you are today again.
Thank you.
All right. Thank you so much again. And thank you to our listeners. We'll see you on the next one. Take care.